Hello everyone, welcome to Pediatrics by Dr. Anand. If my voice is possible to everyone, please put a message in the comment section. Is my voice audible? Yes or no? I think yes. Hello everyone, this is the beautiful magical platform
Please
of
put a message in the
Unacademy,
comment section.
and my name is Dr. Anand. Let's start the beautiful segment. I hope my voice is audible to everyone. Yes. Okay, one second. Yes, now it is audible. I also can hear my voice. आवाज आ रही मेरी आ रही वेरी गुड चलो लेट्स स्टार्ट द ब्यूटीफुल जर्नी दिस इज द अनअकैडमी नीट पीजी प्लेटफॉर्म आई एम आनंद भाटिया assistant professor and yeah I don't look like assistant professor but yes I am the youngest assistant professor what to do. This is the Unacademy NEET PG platform. First of all, we have this beautiful week second going on of the NEET PG test calendar in the month of March. Very beautiful. Like we have the March 7th, March 8th, 9th, 10th, 11th, 12th, free. All tests are free. All you have to do is participate in the test. It will be nice. Okay. It will be really good if you participate. And once we finish this PGI Chandigarh quiz, also, I have put another quiz test for you, surprise test. I will let you know about it. Hello, Vaidehi. Hello, what's up? Also in the Unacademy, we have something known as plus subscription. What is that? Basically, you get all the amazing access to my beautiful classes. Also, at the same time, you can watch me on any of the platform on your Android, iPhone. The educators are really good and the MCQs are good level because many of them I also have made it. And in the iconic subscription, you get the Unacademy platform and the Prep Ladder subscription, all the clinical notes, question bank, rapid revision, everything you get on the iconic subscription. Okay, congratulations to the amazing what you called topper students who work so hard and see their names are there. Now I want Osama Sheikh, Vaidehi, and amazing people faces to be there. Special class, if you're a newcomer to our Unacademy app, we have something known as special class. In the special class, we make a lot of MCQs poll, we chit chat, we talk about life, and we get the rank 1. That's it. Also, boost your medical PG prep. You take a 3 months plan, get 1 month complimentary. 12 months plan, if you take, you can get 2 months complimentary. All you have to do is use a code. And if you want to use a code, otherwise, if you don't want to use, also it's fine, chalega. And the code over here is Dr. Anand. You'll get some financial benefit if you use the code. That's it. Also, yes, we have a mission INI CET 2022 batch. March 9th to May 9th. Are you interested? Do you want to participate? Yes or no? If yes, then let's come up. Let's do it together. Also, we have a NEET PG 2022 high yield MCQ marathon batch. High yield MCQs are everything, you know that. And as FMG exam are coming, so we have a FMG batch. That's it. And last but not the least, we have a revision batch where I take a revision class. Then you have time for self-study. Then I'll take another test, and then we have a solution discussion. Like a proper way, whatever you need to get a rank 1, you have it. That's it. So I've told you about the plus subscription, iconic subscription, the beautiful prizes. At least minimum 3 months you can take and start off with the journey if you want to get rank 1. Okay, let's start the beautiful segment. Today's topic of choice is PGI Chandigarh last 3 to 5 years question papers. Are you ready? Yes. Hello Savan Singh. Hello Savan, क्या हाल है भाई? मिलते हैं अभी 1 1.5 घंटे बाद. Savan stays near to my house, so 10 बजे हम मिलेंगे. We'll have ice cream together. So yes, are you ready? Hello Anurag, hello Savan, hello Osama, hi Priya, hello beautiful people. Before starting any amazing, mind-blowing, beautiful session, we always have a motivating quote, and today's motivating quote is: you are the artist of your own life. You are the artist of your own life. Don't hand the paintbrush to anyone else. You are the artist of your own life. Don't hand the paintbrush to someone else. Look, I would like to say that you should be only responsible for your happiness. Don't give the thread of your life to someone else. That if someone else, like, your life should not be dependent on someone else's mood. If someone is good to you, then only you'll be good. If someone is bad to you, then your mood will go bad. No, your mood should be dependent on you. There are million people saying critiques about you. Do you have time to listen to all those critiques? Is your mood dependent on that? उसने तेरे बारे में ऐसे बोला था बोल के. Since that person told bad about you, that person, then she also told bad about you. Is your mood really dependent on someone else saying to you good things or a bad thing? No, right? Your mood is dependent on what? Your mood is dependent on yourself. You are self amazing, you are self independent, you are self sufficient. Your mood is not dependent on how he, she, or they think about you. You should not have even time. If someone comes and tell you ना पता है क्या वो तेरे बारे में क्या बोल रहा था वो, you should say hello. Please keep it to you. Don't tell me all that. I don't have time. My vision is something else. My journey is something else. You know, same people come to me also tell, पता है आनंद सर आपके बारे में पता है वो क्या कह रही थी वो क्या कह रहा था. मैंने कहा हेलो अपने पास रखो, मुझे बताने की जरूरत नहीं है. मेरी जिंदगी कुछ और है, मेरा जर्नी कहीं और है. आई एम ऑन अ डिफरेंट पाथ ऑफ लाइफ ब्रो. आई डोंट हैव टाइम. आई नो वन कैन पुल मी बैक. माई वाइब्स आर रियली समवेयर एल्स. दे आर वेरी वेरी स्ट्रांग एंड दैट्स हाउ योर वाइब्स शुड बी. Understood? Yes. Oh, yes, yes. Hmm. Hi Harika, hi Anurag. Let's start the beautiful journey, okay? And again, as Napoleon said, if you cannot do great things, do small things in great way. If you cannot do great things, sir, all subjects I'm not able to finish, sir. All 18, 19 subjects, how can I not? No, sir, I'm not able to finish only. If you cannot do great things, do small things in great way. Finish pediatrics, finish ophtha, finish anatomy. Small, small, small. बूंद से सागर बनता है. बूंद से सागर बनता है. Remember that. Okay. Yes. Monimala Naskar says you are a perfect teacher and you are a perfect student. That's what. Let's start the beautiful journey. Cutie, cutie, baby, cute too, cute too. Let me put a small smiley. Yes, cute. My first patient. Many of students think that this is my child. I don't have a child. Remember that. Okay. PGI Chandigarh, May 2019 questions. Let's start. Yes, so see, the questions are little level, okay? They are thoda sa level wale questions hain. Let's try to get a beautiful answer out of it. Which of the following is the most commonest cause of the non-immune hydrops fatalis? What do you think, anyone? What do you think, Savan, Grims, Priya? एक तुक्का मारे फिर आपका भाई आपका सही जवाब बताएगा. Yes, exactly. Anurag says, really, sir, you are a big motivator. Thanks, bro. We will rock this planet, I'm telling you. Just be with me, that's it. Okay, yes. What do you think? Which of the following is the most commonest cause of non-immune hydrops? Anyone? I also don't know. No idea. I also forgot. No, मुझे भी नहीं पता. Okay, let's find out. Osama says A. Julie Tigri says parvovirus. So let's start. Let's start. What is immune hydrops? What is non-immune? We have to connect, right? Okay, what is this? If I show you this picture, then what can you tell? Can we appreciate anasarca? Yes or no? This is a typical case of hydrops fetalis. What can we appreciate in this picture? Can we appreciate generalized edema? Number one. Can we appreciate ascites? Full baby, full blown up baby? Yes or no? Generalized edema, ascites, pleural effusion, pericardial effusion, nothing but anasarca, generalized body swelling. Where do you see? Do you see in erythroblastosis fetalis? है ना? So that's what. See, there are two types of hydrops fetalis. One is immune hydrops fetalis. One is non-immune hydrops fetalis. Okay, in the immune hydrops fetalis, it is the most often a complication of severe form of RH incompatibility. What is RH incompatibility? If the mother is negative blood group and the baby is positive blood group, they will fight together. The mother is pregnant with a negative, mother has a negative blood group and baby has a positive blood group. Negative positive क्या करते हैं? They will start fighting. Nothing but hemolysis, nothing but incompatibility, right? Nothing but problem. What problem? The baby will have hydrops fetalis, the picture which I showed you, right? Erythroblastosis fetalis or hydrops fetalis. Remember, but this hydrops fetalis is known as immune hydrops fetalis. It's most often a complication of severe form of RH incompatibility. Remember, there are two types of hydrops fetalis. This one is immune hydrops fetalis and another one is non-immune hydrops fetalis. Non-immune hydrops fetalis, the most commonest cause is parvovirus. Usually non-immune causes of non-immune hydrops fetalis, the causes are the viruses. Parvovirus, cytomegalovirus, toxoplasmosis, or all the torch wala part, yes or no? Are you understanding all the torch wala part? The toxoplasmosis, syphilis, herpes, cytomegalovirus, and parvovirus. They all are the causes of non-immune hydrops fetalis, and the most commonest cause of hydrops fetalis, immune hydrops fetalis, will be RH incompatibility. Okay, so that's what the question was, which is the most common cause of non-immune hydrops fetalis. तो उन सब में से the most commonest one is parvovirus B19. समझ में आ गया? Yes or no? अनुराग, हारिका, श्री हारिका, प्रिया, सावन सिंह एंड ओसामा शेख। समझ में आ गया ब्रो? इम्यून एक होता है इम्यून हाइड्रोप्स फिटालिस, एक होता है नॉन इम्यून हाइड्रोप्स फिटालिस। द की होम मैसेज इज कि भैया इम्यून हाइड्रोप्स फिटालिस द मोस्ट कॉमनेस्ट कॉज इज बिकॉज ऑफ आरएच इनकम्पैटिबिलिटी। बच्चे को पूरा होगा हाइड्रोप्स फिटालिस, मतलब पूरा एनएसआर का। नॉन इम्यून हाइड्रोप्स फिटालिस में बच्चा होगा हाइड्रोप्स मतलब पानी, पानी भर जाना। हाइड्रोप्स फिटालिस बच्चा पानी से भरा हुआ है पूरा मोटा एनएसआर का। But the non-immune causes will be the viruses, and the parvovirus is the most commonest cause. Done? Yes. अनुराग कह रहा है यस सर, कभी नहीं भूलूंगा। क्या आप मेरा नाम भूलेंगे कभी? यस और नो, इस सवाल का जवाब दीजिए आप। Next question. Which of the following can cause hypertension in children? See, PGI Chandigarh questions are really smart and they are to the level, okay? And most importantly, remember, PGI questions are always, sometimes multiple options are correct. Multiple options are correct, okay? So just give a discussion. It's a discussion. I want your brain to visualize all the aspects of life. PGI questions, NIMHAN question. In the next series, I'm going to start the INICET questions also. So we'll cover everything. NEET PG we have already covered. AIMS we have already covered. Right now we are covering our ye wala part, what you called this PGI Chandigarh. In the next segment, I'm planning to cover the INICET questions. I hope you are a part of it. Okay. So yes, what do you think? Anyone? Dr. Sawan Singh, what do you think? पहले सवाल का जवाब दीजिए, अपनी बेइज्जती करवाइए, फिर दोनों भाई बात करेंगे इस बारे में। What do you think? A, B, C, D, E, F, G, H, I, J, K. नहीं, ती पांच ही है. A, B, C, D, E. What do you think? Which of the following can cause hypertension in children? Who children? सावन. सावन is the child. सावन में, सावन क्योंकि बहुत मोटा है, सावन मोमोज खाता है, सावन एक हमारा जूनियर है, उसको हाइपरटेंशन क्यों होगा? ओके, प्रिया सेज C और E and E. ओके, ओसामा सेज B, C, E. ओके, क्यूट. नाइन किस कोई और रह गया तो कोई ABCD बोल दो, खत्म हो जाएगी कहानी। हाँ जी, लेट्स स्टार्ट। Hypertension. How do you define? Anyone? How do you define hypertension? क्या जवाब देंगे आप? क्या होता है हाइपरटेंशन? बीपी मोर देन 90th सेंटाइल, और 90 to 95th, और 95th to 99th, or 99 plus 5 millimeter of mercury? What do you think, anyone? Savan, tell me the answer. Hypertension is defined as BP more than 95th centile for the age and height. ओके, ये तो याद रखना है, ठीक है? एक बच्चा है, विल टेक द ब्लड प्रेशर, देन आई विल ओपन माई ओपी घई बुक. माई ओपी घई बुक हैज अ वेरी ब्यूटीफुल चार्ट ऑफ द ब्लड प्रेशर फॉर बॉयज एंड गर्ल्स, एंड इट हैज परसेंटाइल्स 90th, 95th, 99th. So any baby for the age and sex blood pressure more than 95th percentile is known as hypertension. Then we have something known as pre-hypertension. We have something known as pre-hypertension. Please, whatever we are studying, learn, revise here only. कल रहे ना रहे, मैं क्लास लूँ ना लूँ, क्या पता मैं कभी वीडियो अगला तुमसे साथ हम कर ही ना पाएँ, तो इसलिए जितना है जो है उसको अच्छे से जियो. तो हाइपरटेंशन इज बीपी मोर देन 95th सेंटाइल. तो प्री हाइपरटेंशन, प्री डू यू थिंक प्री इज 90 to 95th? yes or no? Oh, let's see. Oh yes, oh yes. More than 90th and less than 95th is pre-hypertension. समझ में आ रहा है? yes or no? एक होता है हाइपरटेंशन. सावन समझ में आ रहा है तेरे को? मेरे भाई कई दिन बाद आया तू, आई रियली मिस्ड यू. और सामा, जूली, पूछूंगा अभी और जवाब नहीं दिया तो फिर देखना. एक तरफ है डंडा, एक तरफ है चप्पल, और एक तरफ है टेडी बेयर एंड एक्लेयर्स विद अ 5 स्टार ऑल्सो. अगर पैनकेक होती तो हम फेरो रोशर भी रखते. What is hypertension? BP more than 95th centile. What is pre-hypertension? BP 90 to 95th के बीच में. What is stage 1 and stage 2 hypertension? Yes or no? Can anyone tell me stage 1 and stage 2? देखो, BP more than 95th is hypertension. Then 95th to 99th plus 5 millimeter mercury. ये याद रखना, easy है, समझ में आ रहा है? Can you see that it's easy only? एक चीज पकड़ लो, बाकी सारा उसके एसोसिएटेड है. Stick to one thing, the other things are associated with that. Hypertension is blood pressure more than 95th centile. 95th to 99th plus 5 millimeter of mercury is stage 1. 90 to 95th is pre-hypertension. More than 95 is hypertension. 95 to 99th plus 5 millimeter of mercury is stage 1. And what is stage 2? क्या बच गया stage 2 में? Stage 2 is 19, stage समझ में आ गया? Stage 2 is more than 99th plus 5 millimeter of mercury. इतना समझ में आ रहा है या दिमाग के ऊपर से जा रहा है? अगर आपके दिमाग से ऊपर से जा रहा है, यू मस्ट विजिट टेम्पल, प्रे टू गॉड, गॉड गिव मी ब्रेन्स, गिव मी ब्रेन्स. तो ये समझना जरूरी है, ठीक है? कैन वी रिवाइज? व्हाट इज हाइपरटेंशन? बीपी मोर देन 95th सेंटाइल. What एक चीज समझ, stick to one thing. BP more than 95th centile is hypertension. What is pre-hypertension? BP between 90th to 95th. What is stage 1 hypertension? 95th to 99th plus 5 millimeter of mercury. And stage 2, more than 99th plus 5 millimeter of mercury is stage 2 hypertension. समझ में आया या नहीं आया? पहले इतना बता दो मुझे. और सामा समझ में आया? Please put a like button on this video right now if you are able to understand. Yes or यस यस. जुकाम हो गया 2 दिन में, बर्थडे मेरा जुकाम पहले हो गया. मेरे को पता नहीं किसकी संपर्क से मेरा जुकाम हुआ है. हाँ जी, समझ में आया कि नहीं आया? समझ में आया है तो ही मैं आगे बढ़ूंगा, नहीं आया तो टेल मी, आई रिपीट. ओसामा. लेट्स मूव फर्दर. Okay, I'll give you one kit kit. I'll give you one kit kit. If anyone can tell me any one cause, just one cause, any one cause of hypertension, half kit kit I will take, half I'll give you. Any idea? Any idea? This Monimala, Naskar, Harika, Osama, Priya, Savan. I want you to use brains, bro. पढ़ाने को तो मैं ऐसे ही पढ़ा दूँ. But what's the use if you don't speak, if you don't participate? There's no use of sharing knowledge. What do you think? Pediatrics पूरा पढ़ा है, इतना रिवीजन चल रहा है. Tell me one cause, one basic cause of hypertension. What do you think? Anyone? Dr. Osama Sheikh? Yes. So, बच्चों में it is divided. Are we talking about infants? Are we talking about the young adults? In the infants, have you heard of, see, kidney is the big problem, okay? Kidney is the culprit. Always remember. So, renal is the problem, okay? Renal artery thrombosis or renal vein thrombosis, that is one important cause of hypertension. Kidney ka issue. Again, congenital renal anomalies. Remember always, okay, kidney is the main problem. If my kidneys are affected, my urine output will go down. I'll have oliguria and urea, and I will have hypertension. My body reflex mechanism, hypertension will be there. Okay, yeah, RAS will activate, causes sodium water retention, so BP will increase. So the causes of hypertension are renal artery thrombosis, renal vein thrombosis, congenital renal anomalies, and what else? Any cardiac condition? You know, ये मैं नहीं बताऊंगा. No, I am not going to tell you. जूली इधर आ जाओ, आओ इधर आओ. हाँ जी, ओसामा कहाँ है? देखते हैं कौन आंसर करेगा. ओसामा एंड सावन एंड जूली. हाँ जी, who will answer? Do you have any cardiac condition which causes hypertension? कहीं पढ़ा है आपने? Have we read anywhere any cardiac condition? 25 बार पढ़ा है, 25 बार. हाँ जी, anyone? हाँ जी, सावन से anyone? Okay, Ankit Bhaiya Bharias. Hello sir, how are you? I'm good, Ankit. How are you, sir? How are you? I'm good, sir. Thank you so much for asking. हाँ जी, exactly. ओसामा शेख ने जिया है बहुत ही बढ़िया सवाल. ओसामा शेख को मिलता है एक छोटा सा दिल. And yes, coarctation of aorta. Yes or no? Very good. How will the patient present of coarctation of aorta? 25 बार कम से कम रिपीट हो चुकी है लाइन. If this is my aorta, this is my ascending aorta, this is my arch of aorta, and this is my descending aorta. So over here, coarctation, imagine there is a kink or there is a block here. If there is a block here, the blood from the descending aorta is not able to travel down. So more and more blood on the upper limbs and less blood on the lower limbs. So feeble femoral pulses and bounding upper limb pulses. And naturally, when more and more blood is there in the upper limbs and less blood is there in the lower limbs, change in the blood pressure of the upper and lower limbs, leading to hypertension in the upper limbs. So very important, one of the important causes for hypertension, exactly. One of the important causes for hypertension in children, in infants, is coarctation of aorta is very important. Okay, and then bronchopulmonary dysplasia also. At least, the story is how much do we remember by this session, okay? So try to have a healthy discussion. Again, what are the causes of hypertension? Sir, it depends, infants or adults. In infants, always kidney affect hota hai to BP बढ़ता है. Number 1, renal artery thrombosis, renal vein thrombosis, renal anomalies, coarctation of aorta, cardiac condition also must important. Then बच्चों में any one thing? Priya, very good. Priyanka, Julie, and this one Savan and Osama. In children, again, same thing only. Renal artery stenosis, okay? Renal artery stenosis and Wilms tumor. Wilms, again, have you heard of Wilms tumor? Have we read anywhere of Wilms tumor? Stage 1, stage 2, stage 3. Remember? Do you remember that? Yes or no? अभी परसों ही क्लास करिए. जूली इधर आ जाओ. जूली बेटा आओ. आज पढ़ के आयो. आज क्लास अटेंड करनी है. अच्छी लगती डॉक्टर आनंद क्लास? अच्छी लगती है आपको डॉक्टर आनंद की क्लास? ओह सो स्वीट. टेल मी what do you do in stage 1 Wilms tumor? What do you do? Do you want to do chemotherapy? Do you want to do nephrectomy? What do you want to do in stage 1? Can anyone tell me? Stage 1, stage 2, stage 3 Wilms tumor, what is the treatment? Anyone? If you're a newcomer, watch my previous class on the Wilms tumor. 1 hour proper discussion we have done 2 days back only on the Wilms tumor. So does anyone wants to comment anything? Exactly. In the stage 1 Wilms tumor, my tumor is confined to the kidney. It is confined to the renal capsule. So please उड़ाओ मेरी किडनी को, please remove my kidney. Nephrectomy is the treatment of choice. Do you want to give chemotherapy in stage 1? No. We don't want to give chemotherapy in stage 1. Stage 1 only nephrectomy. Stage 2 Wilms tumor. My tumor has gone beyond little outside kidney also. In this case, of course, the tumor is resectable. I will do the nephrectomy. Plus, I would like to do chemotherapy. याद है कि नहीं याद है? 18 वीक्स के लिए करते हैं, और स्टेज 3 में 24 वीक्स के लिए कीमोथेरेपी देते हैं, स्टेज 2 में 18 वीक्स के लिए कीमोथेरेपी देते हैं. डू यू रिमेंबर दिस? यस और नो? ओसामा कह रहे नहीं याद. बहुत अच्छी बात है, बहुत अच्छे, वेरी गुड. हाँ, वेरी वेरी स्मार्ट, गुड बॉय. सामने होता तो बताता तेरे को मैं. हाँ जी. सो दीज आर द कॉजेज ऑफ हाइपरटेंशन, रीनल आर्टरी स्टेनोसिस, Wilms tumor, neuroblastoma, and coarctation of aorta again can happen in a what you called children also. I'll give you one 5 rupees ka. What should I give you? I'll give you that टकाटक. किसने टकाटक खाया? ओसामा कट. वो टकाटक याद है किसी ने खाया? वो ऐसा नहीं हो सकता. Once you open that packet and put above your tongue, that prrrr, like some popcorn kind of a thing happens. Do you remember टकाटक? टकाटक ही था ना वो? क्या था? उजूली है, बताना जरा यार. वो क्या बोलते हैं उसको? टकाटकी तो बोलते थे, कुछ था ना जो वो पेपर्स जैसा फील होता था. किसी को याद है या किसी ने नहीं खाया है करके? है सावन? क्या क्या बोलते हैं उसको? टकाटक कहते हैं क्या? मुझे याद नहीं आ रहा डियर, बताना. Exactly. So I'll give you a 5 rupees ka takatak if you can tell me what is the late manifestation. What is the late manifestation of coarctation of aorta? If today I'm suffering from coarctation of aorta, after 3 months, which is the one exclusive finding you will see in my body. Anyone? Any random guesses? It's a very important question. We always should link and study. तभी याद होगा, वरना याद नहीं होने वाला, बता रहा हूँ मैं. ठीक है? Exactly. Anyone? इधर आ जाओ. टकाटक इज लाइक कुरकुरे. टकाटक, अच्छा वो जूही चावला की आती टकाटक ऐसे करके. मुझे वो तेरे को याद है हम मैं क्या बात कर रहा हूँ? वो जो हम यहाँ डालते थे मुंह में, और वो ऐसे नहीं होते थे कुछ ऐसे फीलिंग से आती थी, कुछ बोलते थे उसको, मुझे याद नहीं आ रहा. किसी को याद आए तो बता देना, ठीक है? मैं टुमारो विल गो एंड बाय. आशुतोष आए, डॉक्टर आशुतोष. गुड इवनिंग सर, बड़ी जल्दी आए हो. शादी है? हैं लेट क्यों आए? क्यों लेट किस लिए? हैं मजाक चल रहा है यहाँ पे? मिठाई लाऊं? मिठाई खाएगा? हैं या चप्पल? Exactly. Mayur is right. Most importantly, yes, inferior rib notching. Inferior angle of ribs में notching is seen. Why, sir? Because collaterals are formed in a case of coarctation of aorta. As there is a coarctation, blood is not able to go to the lower limbs, then collaterals, other channels will form for the blood to flow everywhere, and that those channels usually pass through the inferior margin of the ribs, causing rib ka notching. It was a USMLE question. The chronic or late finding of a coarctation of aorta is inferior rib notching, and the early manifestations are change in blood pressure of upper and lower limbs, bounding upper limb pulses, feeble lower limb pulses, cyanosis, and this and that. Okay. Exactly. And the causes for hypertension in adolescent age group is essential hypertension. Then endocrine causes. Yeah, endocrine causes are important. So that's why the final answer for this question is, which of the following can cause hypertension in a child? Yes, hyperadrenalism, pheochromocytoma, all the endocrine causes like hypothyroidism and hyperthyroidism, hypo and hyper both. So these are the important causes of the hypertension in children. Please, it's a take-home message that at least what I should remember. At least I should remember that endocrine causes can cause hypertension, pheochromocytoma, hyperadrenalism basically can cause hypertension, and other causes all renal issues and coarctation of aorta. ठीक है, याद रखना. ठीक है. ओके. आशुतोष कह रहा है सर आई वाज कुकिंग शाही पनीर अकेले के. आशुतोष अकेले के लिए? सीरियसली डूड, अकेले? परसों तेरे भाई का बर्थडे है और तू अकेले के लिए कर रहा है करके. यही तुम बना के लाते तो हम भी थोड़ा आराम से खाते. दीपक आया था मुझे याद. दीपक इज इन आर्मी. ही हैड कम टू दिल्ली विद अ वेरी नाइस केक एंड विद अ नाइस अचार फ्रॉम हिज हाउस, एंड ही वाज लाइक सर ये आपके लिए करके आया. आई वाज वेरी ऑब्लाइज्ड. हाँ जी, नेक्स्ट क्वेश्चन. या इट्स अ वेरी गुड क्वेश्चन. Which of the following is not a correct pair of milestone in its age of developing? Very nice, very classy question. PGI Chandigarh questions are really amazing, and I have some 100 questions of PGI Chandigarh. So it's like part 1, part 2, part 3, like that only we have to finish. Anyone, what do you think? Best answer? मैं नहीं बताऊंगा। और सामा बोलेगा नहीं मेरे माइलस्टोन तो बहुत वीक है, तो माइलस्टोन से क्वेश्चन आ गया, मुझे तो याद ही नहीं है माइलस्टोन से क्वेश्चन। बताओ इसका आंसर। बेटा नहीं बताया ना, देख तेरा मैंने क्या करना है, तू इधर आ जा। हाँ जी, हाँ जी, व्हाट डू यू थिंक एनीवन? डॉक्टर जूली और सामा, मुझे भी याद नहीं है, आई डोंट नो, आई आल्सो डोंट नो द आंसर, आई फॉरगॉट, आई फॉरगॉट। हाँ जी, एनीवन? Okay, Mayur says E. Kamal says E. 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 Okay. Question is, which of the following is not a correct pair? Okay, sounds cool. Okay. Yeah, okay. So let's do the easy ones. When can a baby do tripod position? Sitting with support comes by 6 months and sitting without support 8 months. So this is good. This is true line. A baby can transfer objects from one hand to another by what age? 6 to 7 months. A baby can transfer objects from one hand to another by 6 to 7 months. Again, true. Standing with support comes by 9 months and standing without support comes by 12 months. ये भी सच्ची बात है, बिल्कुल सच्ची बात है. Okay. Holding of objects with both the hands. Yeah, that's smart. Holding of objects with both hands. What is he trying to tell here? ये क्या बोल रहा है? कुछ बोलते हैं इस चीज को, holding of objects with both the hands. कुछ नाम है, बोलते हैं कुछ इस चीज को. What do you call this thing? Holding objects with both hands. Vaidahi, Priya, Osama, and Osama again. Vaidahi, the running doctor, also answering very nicely. Then we have Pradeep, Osama, Kamal, Mayur, and Ashutosh. Anji, exactly. This is known as bidextrous. This is known as bidextrous approach. Unidextrous and bidextrous. So 4 and 6, yes or no? 4 months baby can do a bidextrous approach and 6 months old baby can do a unidextrous approach. एक चीज, holding something with one hand is known as unidextrous, comes by 6 months. Holding something with both the hands comes by 4 months by dextrous approach. So Hanji, that's true. Sorry, question number option A, B is true only. Option number A is right. Option number E, pincer grasp. What is pincer grasp? Anyone? Sir, we have two types of pincer grasp, sir. If I'm holding something with thumb and index finger like this is known as pincer grasp. But like not holding the pen, because holding the pen needs intrinsic muscles of hands also. Like आपका बच्चा अंगूर अंगूर पकड़ लेता है, ग्रेप्स खा लेता है. सो ग्रेप्स तो क्या ही खाएगा 9-10 महीने का बच्चा. बट रिमेंबर, कैन योर बेबी होल्ड अ पेबल, कैन योर बेबी होल्ड अ स्टोन और अ स्मॉल ग्रेप, है ना? सो दैट इज होल्डिंग समथिंग लाइक दिस इज नोन एज pincer grasp, which comes by 12 months. And what is immature pincer grasp? Yes, holding something with thumb, index finger, and assisted fingers. Like this. Thumb, index finger, and assisted fingers comes by 9 months, is known as immature pincer grasp. Has everyone got this much? Yes or yes? Anyone समझ में आया या नहीं आया? लेकिन जुकाम क्यों रखे मेरे? आई हेट जुकाम. फिर लीवोसिट्राजिन खानी पड़ेगी. हाँ जी. Has everyone got it? Yes or no? Please raise your hands, class. Teacher is asking, did you understand? Yes or yes? Please. तो आगे आगे बढ़े. अच्छा, जूली सेज नहीं समझ में आया. आओ, तुम्हें तो छड़ी से समझाया जाएगा. Photographic memory, dear. Finish it off. What is this? He is holding something with both the hands. That is known as bidextrous approach. Comes by roughly by 4 months. What is this? This is nothing but tripod position. Nothing but sitting with support or truly sitting with support. Comes by 6 months. What is this? अच्छा, ये तो पूरा ही कहानी है. ठीक है. Yeah, हो गया. What is this, anyone? Is this sitting with support or is this sitting without support? What do you think? Very easy. Mayur, Ashutosh, Priya, Anurag, Osama, and Julie. Yes. So this is this cutie fatty baby. I love them. ये ट्राइपॉड है. किस एंगल से ट्राइपॉड है ये? किस एंगल से ये ट्राइपॉड है? ट्राइपॉड नहीं है ये. Tripod में dear, the baby should be literally just bending, just sitting with support. हाथ उठाते ही he should fall down. If you remove his hand, he'll fall down. Can you see his hand is little on the above part? Yes or no? This is sitting without support. Sitting without support comes by 8 months. जी, very good. ठीक है, हो गया. What is this, anyone? Is this sitting with support or is this sitting without support? क्या जवाब देंगे आप? क्या इस सवाल को छोड़ के आएंगे, फिर मेरे से सुनेंगे आके, या इसको बढ़िया सा देख के आएंगे? सो दिस इज फॉर द बेबीज डूइंग लाइक दिस, व्हाट इज दिस? दिस इज नथिंग बट सिटिंग विदाउट सपोर्ट, सिटिंग विदाउट, ऐसे करके खड़ा है ऐसे। इट्स सो क्यूट, so cute, 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 cute. Oh, I'm so happy I'm a pediatrician. Always I tell everyone, bro, follow your passion. Follow your passion, okay? It's very important, very important. हमेशा मतलब with a great difficulty I have attained maturity and experience in life. एंड विद बहुत संघर्ष मैंने लाइफ में देखा है, और एक ही चीज़ मैंने लाइफ में, ओनली वन थिंग आई हैव लर्न वेरी केयरफुली इज फॉलो योर पैशन. यू नीड टू फॉलो योर पैशन. I like to teach. I think I have some knowledge which I think I can transmit to the younger generation. That is why I'm living on this planet. The question is, why are you living for? If you read some good spiritual books, they have told that we all are here for a reason. We all are here for some destiny in our on this planet. Some are here to sing. Some are here to like be a good motivator. Maybe a singer, Shreya Ghoshal sings beautifully. She's an amazing singer, right? So, what is your passion? What are you good at, right? Anurag says, I want to be a pediatrician like you. You will be a better pediatrician than me. You will be 100 times more amazing and beautiful pediatrician than me. So, all you have to do is follow your passion. Follow your passion. ठीक है? ओके. मोनीमाला से सर एक बार इमेच्योर पिंसर ग्रास्प. हाँ जी डियर, देखो देर इज समथिंग नोन एज पिंसर ग्रास्प एंड देर इज समथिंग नोन एज इमेच्योर पिंसर ग्रास्प, है ना? One is mature pincer grasp and one is immature pincer grasp. If I'm holding something, if this is something in my hand, I'm holding something with my thumb and index finger, something like this, thumb and index finger. This is known as mature pincer grasp. Comes by 12 months. If I'm holding something with thumb, index finger and assisted fingers, like something like this, if the child is holding, not like this, like assisted finger, that is known as immature pincer grasp. Comes by 9 months. ठीक है, समझ में आ गई कहानी? चलो आगे चलो. Oh, it's so cute. Cutie baby, baby, so cute. What is this? Anyone? What is milestone? Look at the picture. We are extremely fortunate that we are having this photographic memory. Photographic memory you will never forget. Theory you will forget, but ये photo कभी नहीं भूलोगे. See this? Can you see this baby is holding something with the thumb and index finger? Like I don't have grapes in my OPD. I only have a pen, right? अंगूर रखने लगे तो सारे मैं ही खा जाऊंगा फिर तो like he is kind of, can you see that holding something like this only, kind of a mature pencil grasp ना, याद रखना. That's it. The best question for question number 3, ladies and gentlemen, is option number E, that it is not a correct pair. It is not a correct pair. Okay, very easy question. मतलब देखो ना, वेक्टरल एनोमली से बहुत ज़्यादा क्वेश्चंस आते हैं. हाँ जी, डॉक्टर सावन सिंह फ्रॉम जलंधर एंड जूली फ्रॉम जकार्ता. So what do you think, ladies and gentlemen? What is the answer for this question? And remember, multiple options are correct. वो आता है ना, रेडियो मिर्ची में आता है, इस गाने की नहीं 106 दशमलव वाले में आता है, इस गाने की फरमाइश की है बिट्टू, टिक्की, मनीषा और कविता ने. हाँ ये भाई भाई और बहनों, यस अब सुनते हैं यस आज का गाना. ओके, जूली सेज ई, मल्टीपल ऑप्शन आर करेक्ट, दैट इज द हिंट. गलत आंसर दे के दिखाओ. हाँ वेरी गुड. सामा क्या कह रहा है? ई. क्वेश्चन क्या है? वेक्टरल एनोमलीज इंक्लूड व्हाट ऑल? मल्टीपल ऑप्शंस आर करेक्ट. एनीवन? रश्मि कुमारी, Priyanka Saini, A, B, C, D, E. Is it A, B, C or C, D, E or D, E? I'll give you 10 more seconds. Fast, 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 fast. Faster finger first, ladies and gentlemen. अब मेरे पास 7 करोड़ तो है नहीं देने के लिए, but I only have my love to give you. So if you want that, do the correct answer. प्रिया से C और E. अच्छा, एनोरेक्टल एनोमलीज नहीं आता प्रिया. Anorectal anomalies is not a part of vectoral, dear. What do you think? Vectoral, VACTEEEERL. What is V से क्या होता है? Anyone? Let's have the picture. So V for vertebral. I think everyone knows that. V for vertebral. A for anal, right? C for congenital heart defects. T for tracheoesophageal fistula or esophageal anomalies. R for renal and L for limb defects and absent radius. One of the DDs for absent radius is this only. So this is vector anomalies. अब इसमें क्या missing है? Ventriculomegaly and cardiomegaly is not a part of vector anomalies. Tracheal issues, yes. Anorectal, yes. Radial limb, yes. These all are the issues. किसने सही जवाब दिया है? Only and only Shri Harika. Shri Harika. Yay! Harika has given the best answer. Very good. And remember, guys, we have this. I think I have told in the special class also. Now I'm starting with this treasure hunt. I'm preparing case presentations and some good MCQs and even some tough case presentations. I'm gonna start with a case presentation slowly, what do you call I will unfold each positive and negative finding, then investigation, then the treatment, and then end. So, it's a proper case. So let's see how you guys participate. And the student who stucks, who says almost the right answer by the end of the whole journey is the winner. And we are having a rupees 500 rupees for the student. And let's see if you can answer that. This week actually I'm starting. Okay. Okay, Parivesh Kumawat says, I'm preparing for NORCET 2022 from NNL and I love the way you're teaching. Thank you. God bless you. Thank you so much. Yeah, good question. Another very good question. Please, these questions are little level, bro. See if you can answer. Diphtheria in a child is characterized by all except. Yeah, this is a good question. Diphtheria is in a child is characterized by all except. Okay, it's a nice question, but it's a tough one, thoda sa. So let's see if you can answer. Anyone? What do you think? What do you think? Okay, and iska hint ye hai ki only single answer is correct. Only single answer is correct. There are no multiple options are correct in this one. Only single option is right in this case. Diphtheria in a child is characterized by all except what is not right. What is not right? A, B, C, D, E. Ladies and gentlemen, what do you think? Osama kahan pe hai? Savan? Anji. Very good. Anji. मयूर सिंह अच्छा ठीक है अनुराग सेज आर अनुराग आर तो कोई ऑप्शन ही नहीं है डियर अपने दिल से बनाया तुमने आर आर तो मेरी गर्लफ्रेंड का नाम है रेखा रश्मि रिया आर ऑप्शन में नहीं है सही ऑप्शन बताओ okay so people are answering beautiful yes option number E is the best answer option number E is the best answer what is that what is option number E. Anterior nares are the most common site for infection. Yeah, this line is false. This line is false. This line is not true. So let's learn about diphtheria, dear. Let's just talk about a 2 minutes topic for diphtheria. Diphtheria, right? What is the Greek meaning of diphtheria? Anyone? Two questions. What is the Greek meaning of pediatrics and what is the Greek meaning of diphtheria? What do you think? See, so beautifully we are learning. Are you able to appreciate that? Like we are, connecting topics, we are connecting, we are integrating studies, we are doing and all that. This is nice. हाँ जी, ओके अनुराग कह रहे टाइपिंग मिस्टेक अच्छा जरूर जूली भी बहुत टाइपिंग मिस्टेक करती है ऐसी सारे ऐसे ही हैं हाँ जी स्वराज सुमन व्हाट इज द ग्रीक मीनिंग ऑफ डिप्थीरिया एंड व्हाट इज द ग्रीक मीनिंग ऑफ पीडियाट्रिक्स yes exactly Osama is right Osama बहुत बढ़िया आंसर ब्रो बहुत बढ़िया diphtheria is nothing but leather the Greek meaning of diphtheria is leather because this membrane which I can see in this picture this membrane is like a leathery appearance like a leathery touch or appearance basically the Greek meaning of diphtheria is leather and what is the Greek meaning of pediatrics किसने बताया again नहीं प्रिया ने पहले बताया child healer is the Greek meaning of pediatrics. Very good. So diphtheria, very nice question. Let's just finish fast. Okay, 10 more minutes, then this class is over. Okay. So diphtheria, is it a bacterial infection or a fungal infection? Anyone? Is this a bacterial infection or is this a fungal infection? I will not tell. You will tell me the answer. It's like an oral test. Test चल रहा है, ठीक है? हाँ जी, बैक्टीरिया से होता है या फंगस से होता है या तुम्हें लगता है दोनों से नहीं होता प्रोटोजोआ से होता है What do you think? Yes, very good. It's a bacterial infection. Perfect answer. Next question. Is it caused by this every one of us knows, right? Diphtheria is caused by Corynebacterium diphtheriae. Is this a gram negative or a gram positive bacilli? What do you think? Anyone? Gram positive or gram negative? What do you think? मैं भूल गया मुझे याद नहीं है Do you remember that? Could you please tell me? Gram positive or gram negative? Anyone? Yes, very good. Nothing but gram positive. Gram-positive bacilli. Diphtheria is a bacterial infection caused by gram-positive bacilli, and of course, everyone knows Corynebacterium diphtheria is the organism responsible. Next question. How it is transmitted? How it is transmitted? Vaidahi, Monimala. People who are answering has a very high chance of clearing this exam in the first attempt. Do you want to clear in the first attempt? Yes. अच्छा, you really want to clear? Then reply तो खाली 5 लोग कर रहे हैं, 5 के नाम, जिन लोगों के नाम मेरे मुंह में आ रहे हैं वही लोग क्लियर पक्का करेंगे, बिकॉज वही लोग ट्राई कर रहे हैं. मिस्टेक्स आर अ प्रूफ दैट यू आर ट्राइंग, राइट? हाउ डज इट ट्रांसमिट? एनीवन? फीको ओरल, हेमाटोजिनस, lymphatic spread. मैं खांसूंगा तो अगर someone has diphtheria, that person coughs, will I have diphtheria? Yes or no? Yes, 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 yes. Okay. Yes, that you should know. Do we have any other infection which happens through droplet infection? Anyone? Do we have any other infection जो droplet द्वारा spread हो सकता है? Yes or no? Simplest answer, TB, है ना? Yes or no? So yes, exactly. Very good. वैसे मोनी वाला छींक के दिखा रही है. Achoo. Very cute. Next question. What is the portal of entry? What is the portal of entry? Does it enters through my veins? Does it enters through my kidneys? Does it enters through my what? Anyone? I will not tell. Anji, even COVID also. Very good. COVID, tuberculosis, and diphtheria happens to droplet infection. Portal of entry. Portal of entry. Respiratory tract. Yes or no? खांसी की और पर हो गया. Respiratory tract. Very nice. Next question. Incubation period. This is nice. Incubation period. Anyone? The time this bacteria enters my body and the time I show you the symptom. What is that window period? How much? What is the incubation period? Anyone? Yes, very good. The running doctor Julie Swaraj Anurag Vaidehi is very right. Nothing but 2 to 5 days. 2 to 5 days is the incubation period for the apna diphtheria. Good. Clinical feature. Anyone? What do you think? Very beautifully you are answering. If you answer, keep on answering like this, your whole topic is over. Diphtheria खत्म हो जाएगा तुम्हारा बातों बातों में. ठीक है? फिर बाद में स्टूडेंट बोलते हैं सर आपने डिप्थीरिया की क्लास नहीं ली सर आपने. आई सर यू डिड नॉट टेक क्लास ऑन डिप्थीरिया. सर कैन यू प्लीज टेक अ क्लास ऑन डिप्थीरिया? वॉच ऑल द वीडियोस, एवरी सिंगल वीडियो टॉपिक आई हैव टेकन. हाँ जी, एग्जैक्टली. श्री हारिका. क्लिनिकल फीचर, पेशेंट कैसे आएगा? एग्जैक्टली. तो विल आई हैव कफ? यस. विल आई हैव मलेज, सोर थ्रोट? या. विल आई हैव नेजल ट्वैंग? विल आई हैव नेजल ट्वैंग? Nasal twang will I have? Okay, yes, that's right. I will have fever. I will have malaise, muscle pain. I will have a toxic look. Yeah, that's very true. And nasal twang, yes, nasal twang I'll have, yes. And nasal regurgitation, very important. You know, I'm telling you frankly, as your brother, this patient comes with this history, nasal regurgitation. Whatever he feeds from naak se bahar aaya, it comes out from the nose. Whatever we give him, it comes out from the nose. Nasal regurgitation is very important. Acha, next thing, what do you call? Diphtheria. पता नहीं क्या बन रहा है खाने में, खांसी और आ रही है. Will does it have ascending paralysis or descending paralysis? What do you think? Hmm. Yes, in diphtheria we have descending paralysis. Descending. Sir, how will I remember, sir? D for diphtheria, D for descending. D for diphtheria, D for descending. Descending, yani as in the patient will have a respiratory compromise first, like a nasal twang, dysphagia or dinophagia, nasal regurgitation. Even the patient can go to ventilator also. He can go on ventilator support also because of the respiratory muscles paralysis kind of a thing, that it will start getting down, so that it causes descending paralysis. What are the various causes of ascending paralysis? I think every one of us knows. Guillain-Barré syndrome, transverse myelitis, traumatic neuritis. Yes or no? Even polio also, poliomyelitis. But usually poliomyelitis and transverse neuritis are unilateral, whereas Guillain-Barré syndrome are bilateral. Transverse myelitis also is symmetrical and bilateral, whereas traumatic neuritis and poliomyelitis is unilateral or asymmetrical. And Guillain-Barré is ascending and diphtheria is descending. Next question. The patient will have a sore throat, dysphagia, and a muffled voice. Yes. What is the principal cause? What you know that? Why ये होता क्यों है? Anyone? Why there is this tonsillar membrane? Why there is leathery membrane happens? Can anyone tell me? Osama? ये डिप्थीरिया में ये जो है this tonsil kind of a thing, this this leathery appearance of this thing, pseudo membrane. Pseudo means false appearance, right? So होता क्यों है ये? Why does it happen? Who will tell me? Exactly. See, this diphtheria, no, Corynebacterium diphtheriae, it liberates exotoxins. There are two type of toxins, endotoxins and exotoxins. Corynebacterium diphtheriae liberates exotoxins and it causes necrosis of the epithelial tissue. Okay, Corynebacterium diphtheriae liberates exotoxin and it causes necrosis of the epithelial tissue. Okay, and that's why this necrosis of the epithelial tissue, na, so it liberates some serous material it liberates, which forms a grayish white pseudo membrane which bleeds on touch, very important. Okay, I'll repeat again. What happens? Corynebacterium diphtheria, right? Diphtheria is caused by a bacteria, no? Corynebacterium diphtheriae. Corynebacterium diphtheriae liberates exotoxins. उसके बाद क्या होता है, क्या करते हैं toxins? They basically, this exotoxins causes necrosis of the epithelial tissue, and once they causes necrosis of the epithelial tissue, one serous material starts coming. It liberates some serous material basically, which forms a pseudo membrane. Like there is a necrosis of the epithelial tissue, and on that there is a pseudo membrane, as you can see in the picture itself. Photographic memory, dear, it can be an image based question, so already it has been a PGI question. So it forms a pseudo membrane which bleeds on touch. That is why a tonsillitis membrane, how do you differentiate a follicular tonsillitis membrane from a diphtheria pseudo membrane? The membrane on the diphtheria is bleeds on touch or bleeds on dislodge or bleeds on touch, whereas tonsillitis, if I have pharyngitis or a kissing tonsils or a follicular tonsillitis, remember that follicular tonsillitis, like this is the tonsil, then whitish patch will be there, that is follicular tonsillitis. मेरे को हुआ था, मैंने tonsillectomy करवाया हुआ है. So in that case, what will happen? It will not bleed on touch, whereas diphtheria wala, it will be bleed on touch. Bleed on touch. What are the various common forms of diphtheria? Have you heard of nasal diphtheria? Has you heard of facial diphtheria? So we have nasal diphtheria. We have pharyngeal diphtheria. Are you understanding? Nasal problem, pharyngeal problem, and nasal में क्या होगा? What is the symptom in the nasal? Discharge from the nose, like a nasal discharge the patient will come with. Which is the commonest form, again star mark PG question, which is the most commonest form of diphtheria? Like in a way, nasal diphtheria is common, or pharyngeal diphtheria is common, or any other form of diphtheria is common? The answer is facial diphtheria. Nothing but you can say tonsillopharyngeal. This one, facial, or like this part, or the tonsillopharyngeal diphtheria is very common. And yeah, exactly. And then we have laryngeal. Are you understanding? Nasal, pharyngeal, laryngeal. Nasal diphtheria comes with coryza, like discharge from the nose. Pharyngeal diphtheria, all pharyngitis, nasal twang, and all that. Laryngeal diphtheria, laryngeal, larynx. I will have a persistent brassy cough. I'll have stridor. And I will have distress. Yes or no? Please don't cram it, okay? Please don't cram. We have nasal diphtheria, we have pharyngeal diphtheria, we have laryngeal diphtheria. Most commonest is pharyngeal or tonsillopharyngeal diphtheria. ठीक है ना, dear? Remember that, okay? And yeah, that's which know. And what is stridor? Stridor is the, everyone knows, right? It is a low pitch. It is a inspiratory. It is a low pitch inspiratory abnormal sound. And how does it, कैसे आवाज, how does it sound? It is like this. Like that. Okay, are you understanding? Okay, so that is stridor, okay, and which is the most commonest cause of stridor? Laryngomalacia. Most commonest cause, a PG question. The most commonest cause of stridor is laryngomalacia, where you see which type of epiglottis? Omega shape epiglottis. How does the distress improve? How the distress is connected to the supine and prone position in laryngomalacia? You remember, right? In laryngomalacia, this omega shape epiglottis I have, no. So distress will increase on supine position. If I become supine, then my distress will increase. If I become in prone position, my distress will relieve. Okay, and the treatment is conservative management. Very good. What is the shape of the neck? What is the shape of the neck in diphtheria? Anyone? Very classy picture. Very classy picture. Who will tell me? Vaidehi, Monimala, Osama, Anurag, Mayur, and Osama Sheikh. 10 more minutes then this class is over. जितना हो पाए खत्म करेंगे, फिर हम part 2 part 3 part 4 करेंगे. And if you guys are free, 10:45 p.m. today, 10:45 p.m. today, I have another 1 hour class on this only, on the Unacademy app. On the Unacademy app, I have continuation class of this PGI question, which are excruciatingly important. And the bull neck. The shape of the neck is, why bull neck? Actually, मैंने question, I should have asked you this question. I should have hided this question. Why there is a bull neck? This was external examiner had asked me this question, that why there is a bull neck appearance, and no one knew. And the right answer is cervical lymph nodes enlargement. Cervical, no, the cervical lymph nodes, they get enlarged. That is why we have this bull neck appearance. It's a very important question. None of the student knew in our batch. Hmm. मोनी वाला नुस्खा से भैंस, बट भैंस भैंस कौन है? And which is the commonest complication of diphtheria? I think it will be a tough question for you. The commonest, naturally, just think, okay, the commonest complication. Okay, I have nasal diphtheria, I have pharyngeal diphtheria, I have laryngeal diphtheria. So the commonest complication will be respiratory failure. Yes or no? Of course, it's a descending paralysis, and most commonest is the pharyngeal one, right? And so tonsillopharyngeal. So respiratory PG question, which is the most commonest complication of diphtheria? The answer is respiratory failure. Please, which is the most commonest complication of measles, which is the most commonest complication of mumps, and which is the most commonest complication of chickenpox? Who will tell me? Fast, fast, fast. Finish करो. Tell me fast. हाँ जी, ओसामा, बताइए sir. What do you think? Very good, very good. We have new names in our class. We have Rashmi, we have Monimala, we have Swaraj, Suman, we have Mayur. Very nice. Yes. The most common, I will not write it, I will just tell. The most common complication of measles is otitis media. And which is the most commonest cause of death in measles is pneumonia. Death is because of pneumonia. And the most commonest complication of measles is otitis media. The most commonest complication of mumps is, you can say, meningitis. Which meningitis? Aseptic meningitis. And in the older children, it is orchitis. Most commonest complication of chickenpox is secondary bacterial infections. And most commonest late manifestation of measles is subacute sclerosing panencephalitis, SSPE. If you're a newcomer, it is like a rapid revision. We have done this million times in our previous classes. A regular student will be knowing कि ये 25 बार पढ़ चुके हैं हम ये. But for the new student, please watch the previous videos. We have done all the videos on every topic. अच्छा, and which is the most commonest complication of this fellow, अपना bull neck diphtheria? The answer is respiratory failure. Thus, which is the most commonest second week complication? The answer is myocarditis. Please have, can we have a hypothetical picture that the most commonest complication was naturally respiratory failure? Then what will involve? Then heart will be involved, right? Descending paralysis. First respiratory, then the heart. In the heart, what do you have? Myocarditis. Then which is the third week complication? Remember, eyes are involved. Ocular palsy, loss of accommodation, visual blurring. Just eye is involved. Let's revise. Which is the most commonest complication of diphtheria? Respiratory. The most commonest complication, respiratory failure. Second week complication, myocarditis. Third week complication, eyes. And last, third to 6 weeks means the last complication. Of course, you can say, like, the our CNS and kidneys. But CNS बच गया, फिर तो CNS is left and kidney are left. So, polyneuritis and oliguria, all those things will be there, right? Can we revise again? Please, let's revise, finish here only. Okay, which is the most commonest complication of diphtheria? Respiratory failure. Second week most commonest complication, myocarditis. Third week most commonest complication, eye problems, visual blurring, photophobia, loss of accommodation. Then late manifestation, like third to sixth week, CNS polyneuritis and kidney oliguria and proteinuria. ठीक है, समझ में आ रहा है ना डियर? अनुराग, समझ में आ रहा है? ओसामा, प्रिया, स्वराज, जूली, ठीक है? And how do you diagnose anyone? How do you diagnose? I have come to you with bull-like appearance. And how do you diagnose? I also don't know. How do you diagnose? Let's finish this topic and let's end this class. You have to answer. I'm not answering. I'm not telling you every answer. Anji, Anurag, Rashmi, Suraj, how do you diagnose? I am a 5-year-old child with bull-like appearance, with this nasal twang. I have a nasal twang. I have stridor also. Little myocarditis is also involved. How do you diagnose? Is it a clinical diagnosis? Do you want to do some test? Do you want to do a throat swab? Like, what do you want to do? Paresh Chaudhary? Yes, the best answer is take a swab. No, COVID wala is same. Take a swab from my oropharynx. You know, right? We have three types of pharynx. We have nasopharynx, oropharynx, and laryngopharynx. So oropharynx. Take a swab. Which through which strain? Albert strain. Albert strain of the swab from the oropharynx is the best answer. And treatment, anyone? Then diphtheria का क्या treatment होता है? Diphtheria antitoxin है ना? So like the way you have tetanus toxoid, you have diphtheria toxoid vaccines also, right? So we have antitoxin. What is the dose? 20,000 IU to 1,20,000. 20,000 to 1,20,000 units depends on the site, extent, toxicity, and even size of the membrane. It's a big membrane or a small membrane. Just remember diphtheria antitoxin. 20 to 120, 20 to 120, like that you should know. And that's why the best answer for this question will be option number E. Anterior nares are the most common site of infection. That is the false statement. That is the false statement. So can the baby can cause fever, malaise, and tachycardia? Yes, true. It can cause fever, malaise, and tachycardia. Membrane can cover the pharyngeal walls, tonsils, uvula, soft palate, and glottis. Yeah, it can cover many things also. No problem. Pharyngotonsillar diphtheria commonly presents as sore throat. Obviously, pharyngotonsillar will have sore throat only. Incubation period 2 to 5 days. Very true. Very true. So all these lines are true. Anterior nares are the most common site of infection. No, most common site is our tonsil only. This tonsillopharyngeal. You know that pharyngeal wala part. 90% is the commonest form is tonsillar only, right? Hmm. Has everyone understood this much? Yes or yes? I think we will end up the class here only. Let's chit chat for 2 minutes and we will end up the class here only after 1 hour, like 10:45 p.m. 10:45 p.m. We have an Unacademy class. If you're a newcomer, download Unacademy, type Anand Bhatia, and you will see my name and follow it, and you will get a notification that you have my class at 10:45 to 10:45 p.m. tonight. We have a class on the this segment. ठीक है? ब्राजी कफ, ब्राजी कफ क्या होता है? परसिस्टेंट ब्राजी कफ, मतलब ब्राजी नाम है ब्रो, लाइक वो उसे एक तो होता है कुत्ता खांसता है, उसे बोलते हैं बार्किंग कफ। ब्राजी मैं तेरे को वीडियो भेजूंगा एक, मतलब एक ब्राजी ऐसे मैं बता नहीं सकता ब्राजी का मतलब क्या होता है, लेकिन एक खांसने का एक तरीका होता है। डॉगी वाला बार्किंग इज बार्किंग कफ, एंड ब्राजी लाइक अ बड़ा ऐसे उन्हें बड़ा ऐसे बड़ा रस्टी 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 हो जाए, जंग लग जाता है ना, किसी चीज को जंग लग गया, वैसे वाला होता है। पर मैं तेरे को उसका वीडियो भेज दूंगा, यू विल गेट एन आइडिया। ठीक है? यस एग्जैक्टली। Penicillin, no, penicillin we don't give in this case. Penicillin we give normally in other conditions, but not over here. Diphtheria antitoxoid, according to OPK 9th edition, diphtheria antitoxoid is more than enough. So before leaving, we had this amazing quote which says, "It doesn't matter where you are coming from. It doesn't matter." So please close your notebooks. Close your notebooks. Relax for 1 minute. I will talk. It doesn't matter. It doesn't matter where you are coming from. All that matters is where you are going. Do you agree with this line? Yes or no? It doesn't matter where you are coming from. You are rich, you are poor, you are an average student, you are a topper, you are a mind blowing student, you are whatever you are. It doesn't matter where you are coming from. All that matters is where you are going. Like my HOD used to say, that it doesn't matter that you are a topper, you are a top ranker, you are all India rank one student. No, it doesn't matter anything. What it matters is where you are going, how well you are doing hard work. And students who are hard workers are always, मतलब they always get the good points. Like तो कहते हैं ना कि कहते हैं ना हार ना मानने वाले की कभी वो नहीं होती, हमेशा उसकी जीत होती है। So it doesn't matter, okay? It doesn't matter where you are coming from. All that matters is where you are going. So what is the moral of the story? Moral of the story is we are emotionally strong, we are emotionally unique, and we are amazing. We are self-sufficient. We have everything what is required to live a peaceful life. We are emotionally independent. And is your life depends on someone else mood? No. Is your life depends on how he or she or they think about you? No. Is your life depends on how the world thinks about you? No. Then what is your life depends on? Your life depends on how you feel about you. Your life depends on how you feel about you, how you live life, how you think positive, how you are happy with whatever happening. Try to be happy. Try to be happy with whatever you have. Acceptance. My personal morale of the story is acceptance is the key. One of my best friend, like I have only one best friend, so he keeps asking me, he's like, you how do you yeah, you तू तो बहुत जल्दी मान लेता है, like you never fight, or I would say cross question or argue or fight. I was like, no, acceptance is the key. Accept it. Any problems coming, of course you try to change it, but first accept it and then try to alter it. Don't get rebellious, don't get negative, don't get abusive. Relax, calm, accept, and then see how well you can modify it, how well you can alter it, or how you can, do things in your own way. Are you understanding? That's what. Thank you so much, everyone, for this wonderful participation. See you in 1 hour at 10:45 p.m. on the Unacademy app, and have a wonderful evening ahead. And thank you. I had a good time. I hope you all had a good time. Thank you.